Physician-assisted suicide. My final persuasive speech by Amiox. Would you want to live your life like a vegetable? Assisted suicide occurs when a physician provides a patient with the medical means and/or medical knowledge to commit suicide. The number of deaths from terminal illness estimated each year. From heart disease, it's over 500,000. Cancer, over 500,000. Alzheimer's disease and diabetes are over 50,000. Only 3 states provide physician-assisted suicide, which is Oregon, Washington, and Montana. Oregon started in 1997 with physician-assisted suicide only. Washington since 2008, and Montana since 2011. In Montana, they haven't completely legalized it because the person who was pushing for it passed away, so they don't have any guidelines as to what physician-assisted suicide rules are. There are also 2 different countries that have physician-assisted suicide, which is Switzerland, which they've been doing it since 1941, and Belgium since 2002, and the Netherlands. Voluntary euthanasia and physician-assisted suicide lawful since April of 2002, but permitted by court since 1984 in the Netherlands. Death with Dignity Act is the act that allows terminally ill Oregon citizens to end their lives through the voluntary self-administration of lethal medications expressly prescribed by a physician for that purpose. The law states a patient must be 18 years of age or older, resident of Oregon, capable of making and communicating healthcare decisions for themselves, diagnosed with a terminal illness that will lead to death within 6 months, and the following steps must be fulfilled. The patient must make 2 oral requests to physicians on separate days, on a separate day between 15 days. Patient must make a written request to physician and sign in the presence of 2 witnesses, one of which cannot be related to the patient. Attending physician and consulting physician must confirm patient's diagnosis and prognosis, which diagnosis is the illness and prognosis is how long they have to live. And both physicians must determine if the patient's capable of making their own decisions. Steps continued. If either physician believes patient's judgment has been impaired by a psychological disorder, patient will be referred for physiological examination. Physician must inform patient of alternatives to the act, including comfort care, hospice care, and pain control. Physician must request, but may not require, the patient to notify their next of kin of the prescription request. Patient can rescind a request at any time and in any manner. These are all safeguards put into place to ensure that all parties involved make an informed decision, that the right is not absurd. The decision must be voluntarily declared by the patient and the physician. Reasons it should be legal. Tremendous pain and suffering of patients could be lessened. The right to die should be a fundamental freedom of each person. Patients can die with dignity rather than have the illness reduce them to a shell of their former selves. Healthcare costs can be reduced, which would save estates and lower insurance premiums. Nurses and doctors can be freed up to work on savable patients. Prevention of suicide is a violation of religious freedom. Pain and anguish of patients, family, and friends can be lessened, and they can say their final goodbyes. Why people choose physician-assisted suicide in Oregon in 2002. 84% feared losing independence and freedom. 84% concerned about decreasing ability to take part in enjoyable activities. 47% concerned about losing control of bodily functions. 37% concerned about burdening their family, friends, and caregivers. And 26% feared inadequate pain relief. Conclusion. As the previous slides show, different reasons for choosing to utilize physician-assisted suicide are important to various people, and only they can decide what is important to them when approaching their death. Legalizing across all of the 50 states would ensure that this option is available to anyone, no matter their age or medical condition, as long as it's terminal. But if this option is not available to someone, their life may be prolonged for a short time. However, their quality may be severely compromised. Is that something that you would want to give up freely?